talking about migratory and seasonal ag worker identification, classification, and reporting, plus an additional element related to COVID-19. So our learning objectives for today are to describe the relationship between verification, UDS reports, and health center funding. We want you also to be able to identify industries and tasks that meet the definition of ag that would qualify and classify an ag worker as in your migrant health program. We also want you to be able to distinguish the different classification types for ag workers. And hopefully by the time we're done, you'll be able to utilize the knowledge you've acquired to correctly determine the ag worker status of your health center patients. In addition, we've added two more learning objectives to today's session. So following the ag worker portion of this presentation, my colleague Gladys Garillo will be sharing information and resources related to COVID-19. And then we'd like to hear from you about your health center's experience so far and how you're adapting to this current reality that we're all facing. So a little bit about NCFH. In case you're not familiar with us, we are a national nonprofit organization based in Buda, Texas, and our mission is pretty straightforward. We want to improve the health of farm worker families, and we do that by providing training, technical assistance, and information services to health centers and other organizations that serve ag workers throughout the U.S. When we talk about ag worker identification, the question comes up often of why should we care about ag workers? These are just a few key facts to think about as related to ag workers in this country, which also helps to illustrate why this is such a vulnerable population. So you'll note that there are an estimated 4.5 million ag workers and their families in this country. And as of right now, only about 22% are being seen in our health centers. So the majority of the special population reports not having health insurance and has not been accessing healthcare services. So we know we can definitely do better by being strategic and developing goals to reach more ag workers in our communities. So the local community of ag workers may change over time due to mechanization, drought, or even new industries that come up in your area that can cause a drop in numbers, or more families may come in where you saw solo males previously traveling. But the need for health centers to reduce barriers to care has never been greater. And hopefully you all are familiar with our Ag Worker Access campaign. It's tied very closely to all of our work that we do relating to increasing access. The Ag Worker Access campaign was launched in May of 2015 as a joint effort by the National Association of Community Health Centers, NAC, and the National Center for Farmworker Health, NCFH. At that time, health centers were seeing a decrease in the number of ag workers served and not keeping pace with the increases in 330G or migrant health funding. So health center staff and other advocates knew that more could be done to increase access to quality health care for ag workers and their families. And the result was the Ag Worker Access 2020 campaign, which has since changed to be known as the Ag Worker Access campaign. And when the campaign was launched, the overarching goal was to reach 2 million ag workers served in our health centers. And as you can see, we haven't reached that goal yet, but we are very close to the 1 million milestone, which is awesome. And that's within reach. Hopefully when our 2019 numbers are released officially, we'll have reached that goal. This is just a little visual to show you as far as the whole population compared to how many ag workers are being served at our health centers. So that's changed slightly to about 22%. So we're doing better, but we still have a large portion of the population that's not being served. So who in your health center is responsible for determining population status of health centers? The reality is the responsibility for determining special population status is the responsibility of everyone in your health center. The board has a responsibility to establish policies and oversee the compliance with local, state, and federal regulations, and this is a federal regulation. The management team has a responsibility to implement board policies by establishing processes, train staff, and monitor compliance. And then support staff not only have the responsibility to follow the established policies and procedures and accomplish the assigned registration tasks, but also have the responsibility to provide feedback to management related to patient difficulties around the registration process and other suggestions for improvement as well. So as you can see, the process for determining special population status is a job for everyone, and we all have a role in it. One of the things that we often see when we're conducting these trainings is a little bit of confusion regarding verification versus eligibility. It's important to note that for purposes of ag worker identification, we are verifying special population status in order to properly document in the UDS. This has nothing to do with the person's eligibility for healthcare services. We all know that all community members can receive services at our health centers, and they may be eligible for a discount based on income, but those are two separate things. And you may ask why it's important to identify patients as a member of a special population. So the federal government has identified groups of community members that have limited access to healthcare services and have unique challenges accessing services, which include ag workers, those experiencing homelessness, public housing residents, and veterans as well. So therefore, the federal government provides funding to support the provision of health services that specially target these special populations. So it's important to report all your special populations, not just ag workers. And these are some of the benefits of accurate identification and registration. Of course, we want to improve population-specific goal setting and performance improvement. We want to facilitate access to care and to appropriate treatment. And we want to ensure accuracy of data and support population research. But of course, the most important reason is to be in compliance with the requirements of the federal government. When your health center applies for funding, they propose to serve a certain number of ag workers. So once you receive the funding, you have the funding obligation to meet HRSA program requirements, provide services to the MSAW population, and also submit your UDS reports, which will result in continuation of your funding. So that's really important. So the UDS stands for Uniform Data System, which is a government-required electronic reporting mechanism for health centers funded under Public Health Service Act, Section 330. This includes community health centers, programs for migrant health or migrant health centers, as well as healthcare for the homeless and residents of public housing. So, who reports what and where? So only health centers that receive 330G funding are required to break down their ag worker population for reporting purposes into migratory and seasonal. If you are not a 330G or migrant health funded health center, you only report in line 16, which is your total number of ag workers. But all health centers report these populations regardless of whether or not they receive special population funding. So if you're not a migratory health center, you will be reporting either way in line 16, so the total number of ag workers served. And just as a reminder, your migratory and seasonal ag worker status must be verified at least every 2 years by migrant health center grantees. So when we talk about verifying MSAW status, we need to know the definition of agriculture, what types of industries and tasks in agriculture are included and excluded under HRSA's rules, as well as the classification of ag workers. And we'll go over each of those. So this is the official definition of agriculture, and we've highlighted in red the parts that we want to really stress to you. But basically, agriculture in definition includes farming in all of its branches. So it can include crop production, animal production, aquaculture, and support activities related to those three. So when in doubt, you should refer to the North American Industry Classification System, or NAICS codes. Those are available online, and the codes that are related to migratory and seasonal ag workers with their subcodes are 111, 112, 1151, and 1152. And you'll see here that they're very specific. So when you look those up, you can kind of determine if your ag workers fit into those categories. So crop production can include orchards, nurseries that grow fruits, vegetables, nuts, Christmas trees, nursery plants, like shrubs, flowers, trees, seedlings, tobacco, grains, and those are all listed in the NAICS codes. And then the support activities that relate to those. So harvesting by machine, sorting, packing, processing, as well as farm labor, contractors, and crew leaders, soil preparation and cultivation, and transportation. The only note on transportation is that it cannot be an independent company that's providing the transportation. It must be affiliated with the farm in order to qualify under the 1151 support activity. Then animal production and aquaculture. So raising and growing animals is a commodity. So all these things, sheep, cattle, even fish farms, and again, those are listed specifically in the NAICS codes. And then support activities, other animal production. These are production that we might not normally consider ag workers. It might be a little more unique. So fur-bearing animals, lab animals, even bees and crickets and worms and companion animals. So those might be sections that you might not currently be considering as in your ag worker definition for classification purposes. So it's good to look at those as well. And then support activities related to those. So boarding, branding, even reproductive services, and livestock spraying, cleaning, etc. So again, you can refer to the NAICS codes. They're very specific, and if you have any questions. And then the tasks performed by ag workers include preparation of soil, planting, detasseling, sorting, canning, feeding, all those things that are listed here. It's important to be aware of tasks that ag workers are doing because they may not always self-identify as ag workers when they come into your health center. They may respond, or they may describe themselves by the work they do, like they may say they pick apples. So it's a helpful tip for you to better identify your ag worker population is to become familiar with the tasks and maybe even have a cheat sheet at your front desk that has what the local industries are and the tasks are, so your front desk staff can kind of guide the conversation with your patients. And then excluded tasks and industries include meat and meat product merchant wholesalers, landscaping services, spectator sports, trucking and timber, and specialized freight. Exceptions to this is when tasks may be done by ag workers and they still qualify. Exceptions as to when ag workers can participate in these tasks but still be classified as an ag worker is when they perform these activities during the off season or when they're not working in agriculture but are still doing agricultural work in the last 24 months. So we've identified 6 steps for the verification process that if you follow these steps should help you accurately identify your ag worker patients. So we want to establish their occupation, determine time frame, determine their migratory status, their seasonal status, identify if they're former ag workers, identify the former migratory ag workers, and then identify all their family members as well. So first we want to establish occupation. We want to find out if agriculture is their principal employment. And the verification question is, have you or anyone in your family worked in agriculture? And if they have, then we go on to the next step, which is to determine the time frame. We always want to know if they've worked in agriculture anytime in the last 24 months. So the verifying question is, have you or anyone in your family worked in agriculture in the last 2 years? Then we want to determine migratory status. So the verifying question is, have you or anyone in your family established a temporary home in order to work in agriculture? So migratory ag workers establish a temporary home, which means they are having to establish a temporary home to work in agriculture. And the distance doesn't matter. It could be going to another state or going to another county. If they have to establish a temporary home to work in agriculture, then we would consider them a migratory worker. A seasonal worker does not establish a temporary home. So if they're not a migratory worker, then we want to determine their seasonal status. So the verifying question is, have you or anyone in your family worked in agriculture on a seasonal basis without having to establish a temporary home? So seasonality is not defined in the legislation, and it's often defined unnecessarily narrowly. Seasonal basis basically means that unlike other occupations or jobs, the stability of work in agriculture varies dramatically and is dependent on many factors, such as weather, demand for the commodity, disasters, that sort of thing. So the instability is what defines seasonality. The worker may experience changes in the type of job they're doing, the task, the hours worked, the wages earned. All those fluctuations help you to determine that they're working on that's considered seasonality. Also, ag workers can work year-round and be perceived as full-time employees, but are still considered seasonal if there's any type of change in their job responsibilities, tasks performed, hours worked, income earned. The fluctuation determines their seasonal status. And in step 5, we want to identify former migratory ag workers. So the verifying question is, have you or anyone in your family stopped migrating to work in agriculture because of age or disability? Aged and disabled are considered, again, former migratory workers. So if you have someone that is no longer able to travel because of that reason, then we would count them the same as there'd be a migratory worker in your UDS. And again, this doesn't apply to seasonal workers, just former migratory. And some of your patients prior to retirement or disability may have been both migratory and seasonal at some point in their career as ag workers. So it's important to ask if they've ever migrated for purposes of work. If they did, then you can classify them as aged and disabled, which would be, again, an M in your UDS. And then we don't want to forget to identify all family members. The Consolidation Act of 1996 changed the definition, or expanded the definition to include family members. So all family members of a verified farm worker are also classified as farm workers. This is regardless of a dependent's insurance status. So the dependents will be classified the same as the ag worker family member, whether it's migratory or seasonal. This directly also applies to children, regardless of what their insurance status is. So a tip would be to cross-check and make sure that everyone in the family is classified as an ag worker, the same as the family member. And it's up to the health center to decide what the catchment area is and what they want to include as family members. So you need to refer to your health center policy for that. So to recap, there are 3 classifications of ag workers for the Migrant Health Program. We have a migratory ag worker, seasonal, and aged and disabled. So for migratory and seasonal, we want to make sure that in the last 24 months, they were employed in ag. Migratory workers, again, are establishing a temporary home to work in agriculture. A seasonal worker did not establish a temporary home. And then an aged and disabled worker is a former migratory worker who's no longer able to work in ag due to age or disability. And then, of course, the family members will be classified the same as the ag worker family member. And one of the resources that we have available on our website is an ag worker identification digital training tool. It's a digital story. It's about 10 minutes long, and it goes through these steps with you. So it's good as a refresher for your staff, or just to introduce the ag worker identification process to your staff. And as a follow-up to this webinar, I'll send the link to you so you can have access to it. And then before we move on, I just want to do one case study so we can kind of make sure you get understanding the information we shared. So for this case study, the patients, there are 3 siblings, and they're needing their annual physicals for school. Their family lives in California. The children have Medicaid, and they travel to harvest asparagus in Washington State between April and June. At the end of June, they travel to Illinois, where they harvest tomatoes. Then they return back to California. So thinking back on the information we've covered and keeping in mind the questions to ask that we have listed here, how would you classify these patients? I'm going to ask you to respond in the chat. And the options are if you think they should be a migratory worker, then please respond A. A seasonal worker, please respond B in your chat. Aged and disabled, please respond C. And if you think they're not an ag worker, then please respond D. And let's see here. And it looks like my responses so far. I have 4 responses so far, so I'll give you another few seconds to respond. And it looks so far, our responses are A, migratory farm workers, and that's correct. They did establish actually 2 temporary homes, so they would be classified as migratory workers. So in addition to the ag worker ID digital story that I mentioned, another resource that's available to you is our IAC Network. Our Increased Access to Care for Ag Workers Network is a learning collaborative of health center networks, primary care associations, and health centers from across the country. And what they do is participate in migrant health action planning to set those goals and strategies for reaching their ag worker population. They participate in quarterly calls. They participate in training through a virtual network. And they share their UDS information with us twice a year to track outcomes. And then, of course, the most important thing that they do is share knowledge, tools, and resources with each other. So that is available to you, and I'll send information as well during the follow-up. And we invite you all to participate in the network if you're interested. And just our resources that are available on our website. Our website is ncfh.org. We have information about the Ag Worker Access Campaign with lots of resources there. We have a migrant health program self-assessment tool, action planning, training and technical assistance that's available to you. We also have templates for policies, procedures, and registration forms. So if you want to evaluate your registration forms and integrate them to have those questions that I mentioned, those identifying questions, you might be able to use those templates to modify. We are also available if you'd like to review your registration forms and make some suggestions. And then these are the 6 national cooperative agreements, or national training and technical assistance partners is what they're called now, that are funded to provide training and technical assistance for those serving ag worker patients. So it's Farmworker Justice, Health Outreach Partners, MHP Salud, Migrant Clinicians Network, National Association of Community Health Centers, and then the National Center for Farm Worker Health, NCFH. So we do encourage you to visit their respective websites and utilize all of our services. So that concludes my part of the presentation. It is more abbreviated than we normally have. If you have any additional questions, even after the presentation, please feel free to email us and we'll get back to you. Make sure that you have your questions answered. But we will take a few minutes to answer any questions you may have. You'll enter them in the chat. Okay, so we have a question from Kelly. If we can share the PowerPoint presented today, definitely. As a follow-up, in addition to the resources, you will receive a PDF copy of the PowerPoint. And again, if you have any questions about that afterwards, please feel free to contact me. I know we kind of rushed through it today, but we want to make sure that you have all your questions answered. And if you need any clarification, just contact us. Anyone else? Okay, if you think of anything after, again, just let us know and we'll be glad to answer your questions. And we are right about 30 minutes, so that's perfect. We're going to go into our next session, our next section of the presentation, which is related to COVID-19. And I'm going to transfer to my colleague Gladys Cadillo to lead us on that.
Thank you, Lisa. And good afternoon, everyone. I appreciate you continuing to stick with us as the second part of this webinar continues. As Lisa mentioned, we want to be responsive to the needs in the public right now, so we have decided to change a little bit of today's presentation and address the concern regarding the coronavirus that's impacting all of our community, including our constituents, community and migrant health centers that are continuing to see patients on the ground. So aside from being able to identify ag workers and vulnerable populations like Lisa just presented, a big issue now that we are faced with is being able to identify individuals being impacted by COVID-19. So NCFH as an organization decided to create a web page where we are gathering and compiling a number of different resources available to you all so that you can have access to the latest information that is available regarding this pandemic. If you go to our website, you'll see here that NCFH has compiled a number of resources in English and Spanish. So Lisa, if you want to go ahead and click on that so we can give our audience a preview of what this website looks like. You will see here the different resources available to you. So like I mentioned, we are staying on top of what the latest information is. NCFH, as part of the Farmworker Health Network, is also working with the FHN to be able to develop resources now in response to COVID-19 that are specific to agricultural workers. Now, the ones that are on our current website are may include this, but most of them are, again, related to information about the pandemic, information about ways different service deliveries are being adapted to what's going on right now. And there's resources in English and Spanish. And we will continue to update that as new information becomes available. We also will update it depending on what the FHN develops so that we can provide you again the latest information related to the pandemic and resources and tools that are specific to the ag worker community so that you can have that information and be able to share it with your patients as well. So to talk a little bit about how COVID-19 is impacting the agricultural industry, we have seen in the time that it's been apparent to us now in the community that operations are being interrupted within the farm worker community. There's a lot that's happening that is really impacting agricultural workers amidst this pandemic, but we are noticing that certain operations have been either postponed or stalled, considering some of the risk factors that are involved with this illness. We are also noticing a shortage in the current labor force. Unfortunately, with a lot of the CDC guidelines in place and certain measures the government is taking to be able to prioritize public health, there are certain restrictions being placed on specific employers. There's restrictions being placed on the public. So in being able to kind of follow that recommendations and stop the spread, we have seen a shortage in the labor force. And specific to ag workers, some H-2A workers that may or may not be starting to work, that's one thing that we have seen. So visas are also being affected by this. Being able to obtain a work permit in order to come to provide that type of labor is something that is being affected, especially considering the closure of borders that's happened recently in the last couple of days. So we have seen that COVID-19 has greatly impacted the agricultural industry, and our ag workers are not, they are included in that. Another thing we've noticed is that migratory workers in particular, so as Lisa mentioned in her presentation, migratory workers are individuals that have had to establish a temporary home in order to work in agriculture. We have noticed that some migratory workers are no longer traveling or able to travel to follow the work because of the safety measures in place. A lot of different places are putting a shelter in place ordinance. We ourselves here in Buda, Texas will be impacted by that today. So this is something that's really affecting migratory workers from being able to continue their employment in limiting the type of travel that they can do. So some of the risk factors that we have seen in specific to ag workers is in relation to COVID-19 is inadequate living conditions. I know as it is, migratory and seasonal agricultural workers sometimes don't have the best living conditions or appropriate housing. You may see that ag workers tend to share housing or have small spaces that they use and live in. So that is a risk factor that we have noted in terms of how COVID could potentially impact this population. So again, their housing may be crowded. They're not necessarily able to practice the physical distancing that is being encouraged at this time. We also have noticed that certain ag workers are already isolated or live in rural areas. So with these current safety measures in place, it can potentially have them be more isolated or have them have less access to care and treatment because of their locations. So as a result, ag workers may lack certain supports that a lot of us may have. They may not necessarily be able to stay connected to loved ones for a number of reasons. I know NCFH has done different trainings, and we continue to explore on how social determinants of health directly impact our population, ag workers in specific. And you'll see here some of those that are listed because that they go hand in hand with how COVID-19 is impacting ag workers as well. So there's a number of barriers that our population is facing in terms of being able to have access to adequate care, being able to have access to adequate patient education materials that are linguistically and culturally appropriate. And this population may or may not be able to understand that information that is being provided because of the limited education that they have. So their understanding of the current crisis may not necessarily be clear, and there can be a lot of misinformation that is being provided to them, or that they are gathering from other sources of information that may not be accurate. Some other factors that you will see, if we go on to the next slide, is that some agricultural workers may not necessarily have telecommuting as an option. They do not have the privilege of being able to work from home, so to speak. So they are unable to reduce that potential risk of exposure to COVID-19. There's also a significant fear of, if they do stay home, that they could potentially lose wages or not be compensated for that time, because unfortunately they may or may not necessarily be eligible for sick paid time off or receive unemployment compensation. So these are just some of the factors that directly impact our population in specific, and that we know that COVID-19 will have an effect on their financial situation in general. Some of the other things that we've noted thus far is with a number of school closures, this population may not have adequate childcare or be able to have access to adequate education and nutrition programs for the children of agricultural workers. And this is a big concern, especially considering that a lot of districts across the country are exploring the potential of no longer having school this academic year. I know even locally that is something that is being discussed now, whether or not children are going to return to school this year at all. So that is a huge concern in terms of how our agricultural workers may be challenged with not having that support for their children and a place for them to be able to obtain education and nutrition with the food that is provided at schools. So these are just some of the things that we've noticed thus far. And of course, outside of COVID-19 impacting our patient population in general, we are seeing how this illness is impacting community health centers across the country. So in our next slide, you'll see some of the challenges that we've observed from the pandemic thus far. And I know that this is an ongoing situation that may bring about some more challenges in the future, but these are just a few that we have taken note of in the last few weeks. Of course, there's a huge, immense increase in the number of patients that may be coming through your clinics with concerns. So there's an overwhelmed operations and workforce in community health centers. There's also a concern, of course, of staff feeling fearful and worried of potential exposure in continuing to work, putting themselves at risk, especially considering the lack of adequate equipment and supplies. I know there has been a shortage of PPE equipment across the country, and there's a call for being able to gain some more supplies across the country. Not only that, though, we have seen an impact in certain health centers having to either reduce their workforce or lay certain staff off because of lack of funding for operations. There's a huge request from our government to be able to receive additional funding to be able to support staff staying in place to provide services in health centers. But even though there is a need for that, again, in following CDC guidelines, there's having a lot of health centers across the country are having to modify the way that they're delivering services. And one area that we have seen greatly impacted by this pandemic is outreach. The Farmworker Health Network is currently exploring whether we can gain maybe information on other strategies to be able to conduct outreach in a different way versus face-to-face, which is something that's been done normally for ag workers. But now, considering CDC guidelines with physical distancing, there is a need to be able to maybe conduct outreach in a different way. So the FHN is currently looking at that and figuring out how we can maybe support community health centers across the country. So whether that means developing training on other modalities to provide outreach so that we can still continue those efforts and support you all as you try to reach this population in a different way. Another challenge is lack of accurate and timely information. Like I mentioned earlier, this situation is evolving every day and there's new information that comes about. So being able to get accurate information to community health centers across the country, and then those health centers in turn being able to provide that information and communicate it to the public. And that includes our ag workers, if those are patients that we serve, letting them know whether or not services are continuing, especially for individuals who experience chronic conditions. So being able to let them know whether or not they're open or if there's been any change in the way that they're delivering services and treating patients. That is a challenge that we have encountered or actually been made aware of by community health centers across the country. So we decided to take a few minutes now, considering that we have you all present and you are the community health centers on the ground, seeing the direct impact of this pandemic. We would be interested in hearing how this is really impacting you directly in your respective organizations and wherever you're located. So if we can, Sylvia and Lisa, open up our discussion and unmute everyone if we can. I think we have a small enough group to be able to do that. The first question that we would like to pose for the group and get your feedback on is, what has been your experience thus far in relation to the COVID-19 pandemic?
Okay, I have unmuted everyone, so if you would like to answer that question, you can, or if you prefer to type it in the chat, you can do that as well.
And again, we at NCFH are truly interested in gathering feedback from you all directly. So we are very eager to hear what your experience has been thus far on how COVID-19 has directly affected your organization or the way that you're needing to provide service delivery at this time.
Okay, thank you, Tanji. Tanji has entered in the chat that they've had modified schedules and also rescheduled all well visits and physicals.
We have heard that a lot of health centers are having to really prioritize what types of patients are coming through their doors at this time.
I can make a comment as to what is our health center experience. Hi there, this is Rocio. Currently, for example, on our outreach efforts, some of the main modifications have been, as you mentioned, there's really not much of face-to-face outreach conducted out in the community or at the place of work for agricultural workers. But what we're doing is, for example, our outreach staff has been serving a very important role at the front of every entrance of our health centers. And they are conducting more of the screening. Prior to any patients that come in, they're screening the patients with the CDC criteria. They have to meet the CDC criteria to be tested, and number one, but everyone is being screened before they are allowed to come into our health centers. So that's been a big change, I consider, as to what their main role has been in the past. Does that make sense?
Thank you, yes, Rocio, thank you. I appreciate your input. I think that that's a good,
and I think that that's also a good opportunity to actually capture some of that information, because right now everything is our attention is all about coronavirus, right? The COVID-19. But that, I feel that it creates a perfect opportunity of maybe screening and at the same time gathering information from our patients. Are you an agricultural worker? And then conduct the additional questions, which I believe we have to push a little harder on that.
Thank you, Rocio. And Joanna has entered a comment in the chat as well, saying they were not prepared with enough of the protective equipment. Updates are daily, so it creates confusion within staff. And a number of patients served decreased last week.
Yes, again, the need for PPE has been great, and that is definitely something that we have taken note of in regards to something community health centers are requesting more of. So that is something that we have seen and we know that is a need.
This is
Sharita. I'm from Westside Family Healthcare. One of the ways that we've been impacted is we have a lot more staff that is working remotely. We're having a lot more meetings because as news is, information is handed down to the administrative staff is being handed down to the staff working in the centers. So meetings are like constant, and sometimes it's emotionally heavy, but it's necessary because, you know, this is something new that we're experiencing. So as we get information, we're passing it down, and it's making us rethink a lot of our processes because of the pandemic that's going on. So,
if you don't mind me, I have a question in that regard. In our case, no one has been laid off. We actually received an Habla Health memo stating that we're a healthcare, as a healthcare organization, we are needed here. So no one has been sent home. No one from administration, especially. We are practicing social distancing as much as possible. The good news is that most of us do have an office, individual office to work at. But the conversation about working remotely has not been one that has been approved. Last I heard, it was something about that it represented a little more liability for the organization. How are you guys adapting to that? How did that work? Or were you required to sign some sort of a waiver?
At our health center, we did not sign a waiver. We are considered, every staff member is considered crucial staff members, so they can come in, but for the staff safety as well as patients, we're looking out for staff safety. So if somebody can do their job from their house or from their home, and it's not going to impact patient care, they're being allowed to do so. So they have laptops, they have cell phones. A lot of the work that people do that we do at the health center is not direct patient contact. So we are using that to continue to provide the service, but also for the safety of staff.
Yeah, I think that's a big concern. And if you don't mind me asking again, what is the center that you're calling from and your title?
So I'm the director of rural health. I work for Westside Family Healthcare in the state of Delaware.
Thank you, ladies. You know, I think it does depend on the service that is being provided at the health center and your area of focus. I know a number of different community health centers are not just primary care. They include integrated services like mental health or oral health, dental health. We actually heard from one of our voucher programs in Kansas that unfortunately a lot of their staff has been put on administrative leave from the dental clinic. So, you know, they're trying to figure out how to adapt services or even, you know, provide care out of pocket as an organization. So it is something that I think depends on your community health center, your funding, and the types of services that you provide. All right.
And we have had
Hello.
3 more comments in the chat stating modified schedules at the dental locations as well. Those staff members have been relocated to medical centers to assist with triaging at all entrances. And then Joaquin states that at his health center, they're trying to increase the amount of telemedicine appointments to still be able to see other patients that need care without placing them in a risky situation. And they are also having tent clinics outside of their facilities. And another, Maria has stated they've modified schedules and screening patients as well. And they have locations divided by well clinic and sick clinic. And all of their outreach has been canceled.
I definitely foresee telehealth being a big component of how we overcome this pandemic for sure. I think I had heard someone that was potentially going to make a comment.
Yes, this is Estela from Aquaculture Health. I'm the manager for the patient engagement department, and we have also been switching over to, instead of in-office visits, we're trying to do as many telephone visits as possible. And our CHWs, we have office cell phones because some of our providers are switching working in office and working at home. So we have in-office cell phones, and our bilingual CHWs are making three-way calls between patients and the providers so that patients are still receiving as much care as possible. We just started screening for COVID-19 in our back parking lot. So again, our CHWs, luckily we haven't had to lay off any of our CHWs because we're considered essential workers as well. And it's been going great. We've screened 2 people so far. So, I mean, long term, we switched our hours from 8 to 5. We no longer are having those night hours for now. But yeah, I think we're just trying to keep up as best as we can and working with our local health departments, translating some documents for them so we can get them out to our Spanish-speaking populations. And my team lead for the outreach team, she is reaching out to like the local crew leaders for the different farms that she has good relationships with to see what we can do to make sure that we're still registering patients, because we have some farms that are trickling in already, or that had come in already before all of this, you know, really started shutting down. So we have some patients that are already here. So we're trying our best to figure out a way. Maybe we can drop off paperwork and make phone calls and help people fill them out like over the phone. And we have good partnerships with Fidelis Care, one of the insurance carriers here in New York, and we're trying to set up same phone renewals for the patients that are already here, and taking pictures, definitely taking advantage of our technology. So taking pictures of like pay stubs and sending them in to our Fidelis Care representatives. So definitely trying to do as much as we can.
That's great. Thank you. And I will say, I thank all of you for continuing to provide services to our community, and being able to hear your feedback today really helps us as an NCA to be able to develop and look at what we can do to provide support to you on the ground. So that leads me to my last and final question of today of what do you need? What can we do at NCFH to provide support and assistance to you as community health centers and migrant health centers amidst this pandemic and serving agricultural workers today? And you can chat it in or say it out loud if you would like.
Gladys, this is Lisa. I had a question from someone that was not able to attend the call that asked if anyone had any guidance in place, if they had adapted their guidance for PPE in the traditional office setting for the outreach setting. Have any of y'all done that? Because we'd be interested in hearing about that as well.
This is James Shuford from Hudson River Healthcare. I know we've had to begin reusing some of our PPE. So people who are using surgical masks are using them for a full day, I believe. And people who are using N95s are reusing them, I believe, 5 times or until they look visibly soiled, and then are discarding them. We're also continuing to do patient transportation, but we have some new policies that are in place where if a patient has screened positive for risk factors, we won't provide them transportation. If they haven't screened positive, we maintain a full row in the van distance between the patient and the driver and other patients, as well as wiping down any vinyl seats afterwards, and plastic wrapping cloth seats and discarding the plastic wrap in between transports.
Thank you, James. That's great feedback. We have actually wanted to hear a little bit about many modifications to transportation protocols. So that's a good idea in terms of how you're handling it and wiping everything down. So thank you for that. Anyone else have feedback for Lisa on that question or would like to respond to that? I acknowledge that we're at time, so feel free if you need to leave and step away. This webinar is being recorded and will be made available to everyone in the future.
How soon will this be available? Unfortunately, I missed half an hour of it. I had a previous commitment and I was only able to call in half an hour ago.
Probably by the end of the week, if the recording converts without any problems, then we can post it probably by the end of the week.
Yes, we will definitely try to get this out to everyone as soon as possible. But any other feedback for us on how we can support you?
I have a comment and as part of the question for that feedback. Right now, as it is, our agricultural population has always been pretty shy, and that's the reason why we're here, right? To properly identify them. This COVID-19 has created a lot more fear than ever before, especially when there's been reports of ICE being at hospitals and deporting people. Whether that's true or not, that is something that is in the mind of these individuals. So a lot of them don't want to come into the centers. And if they do, they don't necessarily want to identify themselves.
Mm-hmm.
So it's tough. So really, how and what can we do in general terms to help them feel more at ease? One of the things that I've been practicing is utilizing the local radio stations to send a message, not just through our recorded commercials, but through PSAs, advising people of the importance of getting screened if they're having symptoms, of not being afraid. But other than that, is there anything else that you or anybody that's in this call that can propose?
I don't hear anyone else responding, but I do encourage you to share that if you have ideas on how to reduce the fear and worry of this population. I agree with Rocio that it's something that unfortunately brings about more fear with the situation now, and how ICE raids are still happening, unfortunately. But it is a very real fear that our population is faced with. So what can we do as health providers to be able to reduce that and still provide information that is essential to their healthcare at this time? But I do think that collaborating with radio stations is a great way to just communicate information to this particular population. We here at NCFH welcome continued feedback. We are open to receive any information that you have for us, so that we can tailor our services, provide you support, develop any resources or tools that you may need to be able to efficiently and effectively and safely do your job on the ground as you continue to serve our population amidst this pandemic. So we'll wrap up here and see if we can answer any final questions. Anything else that we can address to the group about this pandemic in general, or about identifying the ag worker population? Anything about the webinar that we can answer at this time?
So I just have a quick question, if you don't mind me. I noticed that this call, and believe me, for some reason, all the phone meetings that I've had in the past couple of weeks have pretty much been like this. There is a lot of concern. There's a lot of people staying a little more quiet than usual because there's really a lot that we don't know, and that we are not sure what's coming. Well, from looking at what has happened at other countries, I think we know what's coming. we should know what's coming. And I think that's part of the main concern. Our front staff, and back staff are medical providers who are seeing these patients that may be infected. The risk that they are facing on a daily basis on becoming infected themselves. It's a huge concern.
Mm-hmm.
But I wanted to ask real quick in regards to the tent clinics. Someone made a comment as to what they're doing. That you guys moved forward in building like tent clinics outside in order for you guys to see patients. Is it patients in general, or just for coronavirus screening and testing? My question, due to the HIPAA compliance.
And I don't know, and that was a comment by Joaquin, and he did provide a little more clarification. He said that by tent clinics, he means seeing patients outside with the potential COVID-19 symptoms. A decrease in patient visits has also happened for him. So I don't know if Joaquin has phone access and can add more information, but that was what he had added to the chat.
Hi there. This is Joaquin. Sorry, I'm not sure if you can hear me. I'm kind of working from home, so it's kind of hard to hear a little bit. So are you able to hear me?
Yes.
Yes.
Okay, perfect. Okay, so what we've done so far is an attempt to kind of separate patients who are coming in for well-child checks or whatever it may be. Right now, we're not currently doing any well-child checks. Right now, we're at the point where we rescheduled all of that. But those patients who are presenting to the clinic who are at risk or think that they might be in COVID-19 patients, we are kind of screening them outside. A nurse will come out, have a conversation with the patient in their car, and that's kind of how we're moving forward with it. It's just outside of our parking lot, nothing really fancy. It's just even one of those sport tents that you kind of use for events, or even if you go into an event with the family. That's really, really basic, but it has helped us at least make that divide between patients who are coming in for routine checkups or follow-ups or whatever it may be, with those patients who are presenting with possible symptoms of COVID-19. Does that answer your question?
Yes and no. So I guess you that would be more like a screening station for people, not necessarily seeing patients for other reasons, right?
Correct. No, it's specifically meant for COVID-19 possible cases. So people who are presenting with flu symptoms, cold symptoms might be included in that, but primarily it's just to make that separation so we don't. We're trying to prevent any spread. So that's.
Yeah, well, we're doing the same thing, and that's where we have the screening and testing if they meet the CDC criteria. We actually tested an 8-year-old today. So it's not just the elderly, it's
everybody.
It can happen to everyone.
Yeah. It would be the same shared experience with us.
Thank you, Joaquin, and everyone else. Thank you.
Okay.
Yes, thank you for sharing with us. That's helpful to know, and it sounds like there's a system in place to be able to triage these patients.
Okay. Any other questions?
I have a question. I'm sorry, I had to jump off for 1 minute from one of those calls, one of those quick meetings that we're having on the side. But I wanted to know what anybody's experience was with telehealth and the farm worker population. Are they receptive to telehealth?
This is Joaquin again. From our clinic, from our experience, we just moved into telehealth, so we've been calling patients now for 2 weeks, trying to reschedule for well child checks, wellness visits, etc. Those patients that we do reach out to, they are very receptive. They're actually grateful that somebody is calling them in. I know that with our behavioral health, integrated behavioral health, we're also calling those patients, and they're happy to know that we're still caring for them, we're still reaching out to them, and they've been really receptive so far from our experience.
And are those farm worker patients that you're talking about or community patients?
It's a mixture of both. There is some farm workers in there.
Okay, I just have a lot of concern because we're not in the height of our season. And of course, we're thinking about different models of care, going to some telehealth. And I'm trying to see if the farm workers are going to be receptive to being on the telephone or, you know, in front of a laptop for these visits. Are they going to be receptive to that? Because it's like a tough population sometimes to trust. And so we have our outreach staff that usually go out and develop these relationships with them. But because we can't do the outreach like we normally do, I'm just concerned about how maybe they will receive it, you know, I don't know. But I just had a concern about that and wanted to know if anybody had experienced anything that they could share.
Well, an idea is, again, this is Rocio. We just started offering the telehealth services as well. We don't have a lot of experience on it yet, but the little bit that we've had, it's been working out well. The thing is, in general terms, however, in regards to the agricultural population, one of the things that I'm doing today, as a matter of fact, after I get off this call, I will be creating some flyers with information, or work with the site administrators to maybe create a letter that can also be sent out to our patients, our agricultural worker patients, and Medicare patients, pretty much showing them the steps as to how to use it, because maybe some of us can do that, you know, by making a phone call, but for specific populations like Medicare recipients who are agricultural workers as well, the calls, they have to be video. So, and that's through Zoom, and not everybody knows how to use that. So how do we tell an agricultural worker or an elderly person, yeah, we're offering these services, and you can give us a call, or you can connect with us via utilizing your electronic device, your smartphone, but it has to be through a video call, because it's a requirement. So what we're doing is creating a step-by-step, and even at that, I think that's going to be a challenge for some people.
Yes, I think in response to that question, we have seen an interest in agricultural workers be receptive to telehealth. I think, like Rocio mentioned, it's being able to have them know how to log in, how to navigate the tele encounter, so to speak. Another issue and concern is whether or not agricultural workers have access to technology, have access to smartphones, so the platforms to be able to receive these telehealth services is another concern. So I don't think it's so much them being receptive or willing, although I do agree, Ms. Jackson, that there does need to be a strong relationship developed, because you're right, agricultural workers do tend to be more responsive to individuals that they trust. So outreach staff is critical to that. And so being able to continue outreach, but through a different way to maintain those relationships, is going to be crucial for any type of telehealth encounter to be successful, outside of, you know, being able to have the technology and resources and then understanding of that technology in place. So we are thankful for the conversation. I want to be respectful of time. I know it's already 2:48, so we're going to go ahead and start to wrap up. But thank you, everyone, for the feedback, for the active discussion, especially about the pandemic. We, again, welcome here at NCFH your questions, any other feedback on strategies that we can share with other community health centers in terms of ways to push through the current situation and to still provide effective and efficient services to this vulnerable population. I'll hand it over back to my colleagues now. Thank you.
Thank you, Gladys. And Lisa, is there anything else that you want to add before we wrap it up?
No, just to thank everyone so much for participating today, for the great work you're doing, and as always, for your commitment to the ag worker population. I know last year during Health Center Week, we had a whole heroes theme, and you guys are definitely earning that title. So again, we are here to assist you, so please, we encourage you to contact us with any questions regarding the ag worker ID portion or the COVID, and we will do anything we can to assist. And we look forward to you sharing your strategies, even as we move forward and you're adapting your services or whatever you're doing. We look forward to hearing from you so we can share that with other health centers. So thank you so much. And I will be following up with resources and contact info for Gladys and myself so you can stay in communication with us.
Okay.
Yes, one other thing to note, Sylvia, that I just want to make a quick comment of is just to remind everyone on the call today and to hopefully promote it within your health center organizations. Self-care is crucial. I know, again, the fear of staff members working is present. So really encouraging you all to practice self-care, to be mindful of your mental health needs and being mindful of the mental health needs of your workforce as well.
Okay. Thank you, Gladys. And again, thank you everyone for participating on the call and for sticking around for the discussion. Appreciate all of your responses. And again, if there is anything else, any other questions, any assistance we can provide, please submit an email to us. And any strategies, things that are helping you as you are out there serving on the ground. So we will be providing the recording to you as soon as possible, along with a copy of the PowerPoint presentation for today. And you will be receiving also an evaluation an hour after this ends. So please take the time, a few minutes to fill that out for us and give us some feedback. So thank you very much. You all have a good afternoon. Be safe. Take care. And again, thank you so much for all that you do.
Sylvia and Gladys and everyone, thank you so much. I just wanted to bring something to the attention. I know that unless I missed any emails previous to this one that I received this morning, are you planning to do more calls like this? Because I know I got this call at this email at the pretty last minute. Are you planning to do follow-ups in the next weeks or so? Because I think it's helpful in sharing with one another our efforts.
Yes, we can definitely look at that, Rocio. I know the Farmworker Health Network is looking at how we can be most responsive to our constituents, and of course that's you. So any feedback that we can get, so if you think having more open discussion conversations like this is helpful in strategy sharing, then that's good feedback for us to be able to share with the FHN as we move forward and trying to organize what training and support we can offer to you all as community health centers on the ground.
Thank you again.
Right.
Appreciate that.
Thank you, Rocio. Thank you, everyone. Have a good afternoon. Take care.